For most consumers, healthcare is not something they plan for. How many times does anyone plan to get sick from this month to the next? But we are living through a global pandemic that is changing all the rules. In the face of a deadly virus, health can pivot overnight from being something we take for granted to suddenly being the most important and urgent thing in the world. This represents unprecedented challenges and for the insurance industry. How can it rally to meet consumer demand for high quality consultations while reducing the workload on the healthcare system? The answer is telehealth. Like remote working and virtual meetings, telehealth is a technology whose time has come. My name is Oisín Lunny. I'm a senior contributor at Forbes, the professor of UX-driven business at Barcelona Technology School, and I am delighted to be joined today by three of the world's leading experts to discuss why telehealth is the insurance industry's greatest ally during the COVID-19 pandemic. And our special guest speakers today are Fredrik Schneider, the CEO of Abbey Global Health, Dominic Gantner, who is the CSO of Austria and Southeast Europe at Allianz Partners, and Michelle Elmore, who is the head of International Healthcare Business Development at Collinson. Welcome all to the webinar. So we are going to structure it as follows. We're going to have a presentation from each of our special guest speakers, and then we're going to have an open discussion and a Q&A. And so I'd like to commence proceedings by inviting the CEO and co-founder of Abbey Global Health, Fredrik Schneider, the stage to share his thoughts with us. Thank you, Kim.
We work with insurance companies, employers, governments, and NGOs to improve health outcomes for people in 60 countries around the world. Abbey, our pioneering medical micro-consultation service, uses cutting-edge artificial intelligence to connect people to a network of trusted doctors via the world's most popular chat apps like WhatsApp, Telegram, Viber, even SMS. Abbey micro-consultations help people to avoid unnecessary medical visits and accelerate necessary ones. Abbey is used by insurance companies around the world to differentiate their products, engage with their customers, and improve loss ratios. In my brief introduction today, I'll talk about customer engagement, the role of telehealth in the current pandemic, and beans. I promise that will make sense in a moment. I'm delighted to be sharing a virtual stage today with Michelle and Dominic, and I look forward to a productive discussion. It shouldn't be news to anyone that over the last couple of decades, consumer attitudes and behaviors have been radically transformed. Communication preferences are shifting, expectations are growing exponentially, and brand loyalty is at an all-time low. Within this context, insurance companies have struggled to engage with their customers, particularly when it comes to emerging digital channels and tools. Traditional communication strategies are less and less effective as consumers become more demanding, more informed, and more fickle than ever before. And with the COVID pandemic, we can add one more challenge to the list. People are distressed. Just the other day, the government of the United States released video footage of UFOs, seriously, and it was a blip in the news cycle. If people aren't paying attention to UFOs, why would they care about the latest coronavirus discount or special offer? On the other hand, people are consuming news at an unprecedented rate. They are spending more time than ever on digital devices, and in this moment of crisis, they are looking to institutions that specialize in crisis management to support them. This includes governments, of course, but insurance companies are also crisis specialists. The challenge is that insurance companies are designed for relatively small-scale management of individual crises. Can insurance companies now step up and support their customers at scale? Today, you'll hear from two companies, which are Collinson and Allianz Partners. Individuals and companies are reevaluating their finances as never before. What will they think when they see their insurance premium line item? Will they see their insurance provider for what it is, an institution which stands by them in times of crisis? Or will they see an undifferentiated expense and go searching for a cheaper option? Even in normal times, 57% of consumers report dissatisfaction with a lack of interaction with their insurers. What about in the new normal of this pandemic? The key questions facing insurance companies are, first, how do you demonstrate value to your customers in this time of crisis? The answer is to give people what they need. This is a health crisis. Give people health care. The coronavirus is causing widespread sickness, but that's only the tip of the iceberg. As people stay home and try to avoid infection, many other medical conditions are being ignored. If it's not addressed with remote medical support, this health debt may generate a second crisis in the months and years to come. By providing telemedicine services, insurance companies demonstrate their value as partners to their customers. Second, how do you deliver this value? The answer is in the question. You deliver value by not making people come to you, but by bringing services to where they already are. In the physical world, this means home delivery. Amazon and food delivery services are booming, and local shops and restaurants have transformed their business models to meet this new stay-at-home reality. Although digital mobility is theoretically limitless, in practice, people are much more comfortable in their digital homes than they are wandering the web. The most consistently occupied part of this digital home is chat apps like WhatsApp, Telegram, Viber, and others, depending upon the country and demographic. Despite the recent increase in video calls, messaging still reigns supreme, far outweighing voice and video in daily communication volumes. Finally, how do you ensure the long-term sustainability of a value-added solution? There's been a surge recently in video telemedicine. There's also been a surge in the sale of beans. I told you we'd get there. Do we think that the recent shift to beans proves the humble legume will now and forever be a larger part of our daily diets? When it's safe to see others in person again, do we think that we'll continue to meet our friends for a drink via Zoom? It's critical to examine current trends closely to distinguish the difference between permanent shifts in consumer behavior and momentary reactions to the current pandemic. I have no doubt that video consultations will be more popular after this pandemic than before, and I'm sure many will discover the joys of a good chili con carne, but I doubt either will sustain their current level of consumption. If insurance companies offer telemedicine solutions which deliver clear value, which are easy to access and use, and which will continue to be relevant as we transition to a new normal and beyond, then they can be the heroes of the moment and enjoy customer loyalty, which has truly been earned. With apologies to John F. Kennedy, I'll finish by saying, ask not how telemedicine is your ally, but how you can use telemedicine to be an ally of your customers. Thank you.
Fantastic, Kim Fredrik. That was wonderful. And as a child of the 70s, I'm not going to go into too much detail, but UFOs were obviously a big deal in the 70s, as were beans. Beans were anyway. So great to see those two combined in the presentation. Thank you so much. Before we move on to our next brilliant speaker, I would like to invite you all to participate in the first of two polls that we are going to run. It's just our way to get to know you a bit better and to hear your thoughts. And we will share the results of the polls before we all wrap up today. So if you wouldn't mind, you should be seeing a window just on the right hand side of my face, and it will have two tabs, questions and polls. If you want to click on polls, you'll see our first poll, which is asking for your opinion on what is driving the rise of telehealth. And we have a few options there: cost reduction, customer engagement, product differentiation, competitive pressure, or COVID-19. So please take a moment to engage with our poll. This does remind me of a great cartoon I saw on LinkedIn, drawn by Tom Fishburne, the brilliant marketunist. And he asked the question, what is driving innovation in your business? Is it A, you're a CEO, B, your CTO, or 3, COVID-19? So you have the chance to let us know how you're finding things there in this poll. And yeah, there's a lot of people taking part. Thank you so much. That's brilliant. We'll just give you a moment to submit your answers. Okay, it's close between two of the fields now. I'm pretty impressed to see that. That's brilliant. We will share the details and the results of the poll before we wrap up. And just to let you know that all of the presentations that you see today and all of the speakers' contact details will be sent to you tomorrow, together with the replay of our webinar. So if you have any questions or you want to kind of capture anything, we'll do our best to make sure you get it. And we will also have time for Q&A as well. So if you have any questions for any speakers in particular, do let us know. You can ask your questions at any time and we will go and review them when it's time for the Q&A. Okay, so thank you again, Kim. Beans and UFOs. Wow, how do you follow that? Well, I have seen Dominic's presentation and it is really fascinating. And it gives me great pleasure to hand over to our next speaker, who's the CSO for Austria and Southeast Europe at Allianz Partners. Please welcome to our virtual stage, Dominic Gantner. Take it away, Dominic.
Yes, hello. 1 second, let me bring up my slide deck. There you go. Okay, thanks Oisin, thanks Kim, thanks everyone else. Thanks for having me as a speaker today on such an important topic that has just recently been getting the attention it deserves due to the very unfortunate events of coronavirus. As a quick introduction, my name is Dominic Gantner. I'm, as a CSO, responsible for our commercial aspects in Austria and Southeast Europe, and I do work for a company called Allianz Partners. So, as all of you will know about the Allianz insurance, let me briefly tell you what we do at Allianz Partners. So, we're part of the Allianz Group, and within that, we're focusing on the B2B2C segments, meaning we are providing insurance products and services to either the clients or the employees of our partners. We're acting globally, so we're active in 75 countries, and we employ 21,000 people. We do have quite a broad range of a product portfolio, ranging from traditional assistance services like roadside assistance for global car manufacturers to insuring devices for retailers and global telcos. And also, we're acting as third-party administrators for whole product segments such as health. And it's not unusual that we operate under the brand name of our partners, which is probably why the likelihood is larger that any one of you has been receiving or been the beneficiary of one of our services rather than knowing what Allianz Partners is and what we do. So whether you'd have a breakdown of your Samsung phone, or a breakdown in your BMW or your Volvo or your Mazda or your Jaguar Land Rover, or if you're a number 26 customer being hospitalized somewhere in the world, it's most probably that we've actually helped you out. So what do we have to say about telehealth? We're engaged with telehealth on a range of different angles. So first of all, as an assistance company, we are the provider of telehealth. Through our company Medi24, based in Switzerland, we've been providing telehealth solutions for health insurances for the last 20 years very successfully. We're also a user of telehealth because we're one of the largest travel insurances in the world, and we use telehealth solutions to help our clients with their medical needs worldwide. And with Allianz Care, we are a health insurance company covering the employees of large clients such as the NATO, the World Food Program, or the Daimler Group. And also, we have a specialized unit called NextCare. They're operative globally, and they help insurance companies as a TPA to enhance their value proposition in health insurance. And they can pretty much help with from product development to claims handling, or the provision and the steering of a network. So we're quite engaged, and our approach to telehealth is a holistic one. So we believe in a comprehensive ecosystem of a range of different telehealth services and channels, always with the aim to provide the best and most convenient way to give clients access to healthcare. So we have a lot in our portfolio, ranging from self-servicing tools up to more sophisticated solutions like nurse triage, teleconsultations, or video consultations. And what's quite interesting and what's revolving around the topic today as well is how do we see micro consultations, which we already also have. So micro consultations, we really believe that they can play a key role in scaling and delivering the benefits of telehealth to a mass audience. And as Allianz partners and Allianz Group, we're always looking out for organizations or technologies that can really enhance our value proposition. And this is specifically the reason why we've entered a strategic partnership with ABI, represented by Kim today. And a little bit of a personal story. I joined Allianz Partners 1.5 years ago, and a colleague came up to me and said, well, you know, we also have this Dr. Chat. So for some reason, we call it Dr. Chat internally. Kim and I are still discussing where it came from, but it's stuck with us. And I said, okay, what is it? And he said, yeah, you can chat to a doctor. I was like, what's the value in that? I mean, I knew a couple of telehealth offers. I knew we were providing telehealth phone consultations. And I said, I don't see the value. If I want to talk to a doctor, I just call him. And preparing for this webinar, I really thought, what happened that turned me from a real skeptic into almost like an evangelist for the service? And believe me, if you have kids and use it a dozen times to help you out, for example, when you're out to go on a trip or it's the weekend, your little son, 1-year-old, is vomiting, you don't know what to do, and you need some medical guidance, and you can get it in 3 minutes from a real physician, you know what I'm talking about. But seriously, from the position of an insurance company, there is 3 key aspects that make a telehealth solution or any service really great. The first one is a boost in engagement. People who use it love it. The entry barrier for a micro consultation, chat-based, text-based, is quite low. So we see utilization rates that are way higher than usual telephone or video consultations. The second point is scalability. Through technology, we're able to be independent of any specific app. So we could use, as Kim said, SMS, we could use WhatsApp, we could use Viber. And also the way that artificial intelligence as a moderating tool interacts with a real physician makes the solution really scalable and valuable. And the third thing is, from the point of an insurance company, of course, any venture needs a positive return on investment. When we look at cost containment, we see similar effects in terms of cost containment by reducing unnecessary doctor visits and by also being able to steer patients to exactly the doctors we want them to see and we know that we trust and that don't overcharge. So that's the third important point to make here. Maybe just as a quick outlook in terms of how we assess the current situation. We've seen an increase in interest for telehealth solutions over the last 3, 4, 5 years. That was already in place. Of course, through COVID-19, within the last 7, 8 weeks, there was a real spike and a real acceleration in terms of interest, not only from a user perspective, because we see the users that are on the service, they utilize it significantly more than before. We also see it by telehealth services being invented by many different companies, not only covering insurance companies. So we're talking to banks, we're talking to retailers, all looking for a telehealth solution now supporting their clients in this specific challenging situation. And I was talking to Kim the other day, and he said he even got a telehealth offer from his gas provider, which is quite odd. So there's also a little bit, the question is, where are we going, and will this be a sustainable solution, and how is the future going to be? Another interesting topic, despite following coronavirus, is for sure the topic of mental health. We know that there's a lot of strain and stresses on people at the moment, and even though that the restrictions of different countries and governments are loosening up a little bit, there will be a long tail of economic let's say, stressful situations with it. And there will be also the need for psychological care, and this will increase significantly. So you might also want to check out our initiative with Hello Better, and find out how we can help corporations and organizations to improve the psychological well-being of their employees. And that's a similar approach to what we're talking today about micro consultations. And without further ado, I would like to pass on to the next speaker. Michelle, thank you very much. Looking forward to the discussion.
Oh, that's great. Thank you so much, Dominic. Just before we go to Michelle, I wonder, could we interest you, the audience, of which there are now many? It's lovely to see so many people here. If we could interest you in another poll. So if you just look to the right of my head, there should be a poll popping up here. And the poll is, what kinds of telehealth does your company offer? So the potential answers there are video, symptom checker, chat-based, other, and none. So these would be really fascinating, I think, for our three speakers to get a better picture of who is joining us on this live webinar. And Dominic, I just wanted to say thank you for that presentation. That was really, really fascinating. I think you highlighted some very key points around why micro consultations in particular are the new normal, and why it makes sense for consumers, why it makes sense for providers, that amazing overlap between, as you say, cost containment and customer engagement. It's a technology whose time has come for many reasons, but the question you kind of ended on as to its sustainability, I think that's something that we're going to discuss a bit later. And I know Michelle is going to share some amazing stuff as well in her presentation about mega trends that are influencing this landscape. Okay, so I'm just going to submit a vote here. Okay, very interesting results so far. Very good. What kind of telehealth does your company offer? If you haven't voted, please feel free. Just on the right of my face, next to the questions poll tab, there's the polls tab, and fire ahead and share your thoughts in there. That's really, really interesting. Okay, and we will be presenting this before the webinar is finished. Okay, wonderful. So I'm just going to get the next slide deck on the screen using this wonderful technology we have here. And it's actually a great platform, and we're very happy to be using it, but it just requires a few mouse clicks. So you should all be seeing Michelle's presentation there, and now we're going to invite her to the stage to share her thoughts on telehealth. So welcome, Michelle. Thank you so much for joining us.
Thank you, Sheen. Thank you. And good afternoon, everyone. So yeah, this is quite interesting, isn't it? Having to do these webinars. A few months ago, I was in Kenya launching a product in front of 100 people. And I was saying to colleagues today, oh, having that visual eye-to-eye contact. So hopefully I can come across and tell a story about what we are doing at Collinson and the trends that we see. So I'm heading up international healthcare for Collinson, and I've been in international healthcare for about 15 years, and pretty much been in the sub-Saharan market, and you'll see that sort of feel coming through my talk, as I'm quite specialized in those developing African markets. Can you go on to the next slide? Thank you. So a little bit about Collinson. We're a global loyalty and benefits company, and we're family owned, which is fantastic because we don't have any shareholders to be beholden to. We design and deliver exceptional loyalty, insurance, assistance and travel solutions to corporate organisations around the world. There's a few of our brands that we're working with, and you'll recognise them, some of the big airlines, which, you know, unfortunately at the moment, but we are working with them really closely to try and design strategies when they do come out of COVID. So we really straddle a variety of industries, from leading banks and airlines and hotels in over 170 countries. Thank you. So the area I'm focusing on is designing international health solutions, and really our competitive edge is in developing markets where healthcare and infrastructure is slightly weak. Our health strategy is to design and launch contemporary international health solutions that are more geared at and aimed at the local, national or the regional expat, rather than the homogenous expat solutions that are being delivered by other international underwriters. So we get really excited about developing solutions in these markets because we really feel that we can add some value. We're very sort of concierge and boutique view on designing products. And for instance, we're just about to launch a top-up international product in Nigeria with one of the leading insurers down there. Thank you. So I thought it would be really interesting, what COVID, telehealth, propositions in insurance industry, but there was dynamics going on before COVID happened. And I think it's really important to think about those external forces that have been evident before this pandemic. The environmental and customer drivers have been fueling adoption rates across digital health propositions. As a health insurer, we need to be customer centric. The digital consumer behaviours are fundamentally driving companies, including insurers, to rethink their propositions. There are a number of strategies companies can adopt within their customer network. And a key strategy for health is the fact that customers always want to have access to their digital data and interactions more easily, more flexibly, gaining access to services and information quicker and simpler. Services need to be on demand. They want to be able to access information anytime and anywhere. And a really interesting fact was the fact that people look at their phones 150 times a day. Probably for me, it might be more than that. But that just resonates how often we're in contact with our phone. Next slide, thank you. So the opportunity to realign the customer experience. Technology changes across the industry have fueled transparency and more freedom of choice, and hence insurance companies are looking for ways to become increasingly customer-centric, to get closer to our customer. We have immense customer footprints across all demographics and have the opportunity to link into this valued asset. So not content with just paying a claim in a reactionary pay and pray methodology, there is now scope within the insurance industry to be able to link into the customer with more meaningful interaction and seek out behavioural and attitudinal insight that can allow us as a business to take a more customer-centric approach. And this will form a two-way proactive collaboration. The industry is under immense pressure to shift that pendulum from being a payer to engaging with the customer, and not just paying claims, but managing risk proactively. And traditional insurers only have contact, previously they've only been able to have contact with their customers at the point of claiming. This dynamic is changing and the industry is starting to innovate solutions. And to be able to have this exchange in a more meaningful environment, mHealth telehealth services are key to empowering this shift change. Thank you. So we all know that telehealth isn't a new proposition. It has been available for some time in various propositions, but there have been barriers to adoption. The US Centre of Disease Control points out that despite its growth in popularity in recent years, telehealth faces and still faces barriers hindering more widespread adoption. These include information security, privacy, licensing, insurance reimbursement, and liability concerns. But in the wake of this pandemic, we've seen a gargantuan shift change. In the UK, GP surgery is not shut down overnight, and in our markets in Kenya and Nigeria, likewise went into lockdown and totally slimmed down services too. This lockdown has forced a radical rethink on the consumer and how to access less acute healthcare services. One of the barriers that I find of particular interest is habit. We have never not known going to a clinic. This face-to-face practice has been in place for generations, and therefore to be disrupted has been a challenge up until now. Next slide. So we all agree that COVID has accelerated the conversation, but will it be business as usual? When we come out of this, when we can go and see our family and friends, when we go back to the workplace, will it become part of our life? So I think personally it will, and I've just taken a real sort of broad snapshot of some of the key factors that are influencing telehealth propositions. The world will be short of healthcare workers by 13 million in 2035. So regardless of markets, whether you're in developing or emerging markets, there will not be enough healthcare to support the supply. The next generation of users will be the digital native customer segment. As we go through this timeline curve, users of technology will be more intuitive and more expecting of digital propositions. As I previously mentioned as well, consumer behaviour demands instant access. And another key area I'm quite interested in is primary care triaging in developing markets. Take Nigeria, take Lagos, Victoria Island. If you want to drive 3 hours, if you want to drive 2 kilometres in traffic, it can sometimes take 3 hours to get to see your doctor. And again, in Nairobi, if it rains, then you can add 2 hours onto your journey when you leave the central business district. Convenience as well. You know, who wants to sit in a clinic at the moment? Even after this pandemic, I think everyone's going to be rethinking about sitting in surgeries. And finally, the really important key factor for me is the opportunity to leapfrog this bricks and mortar facilities, like how M-Pesa embraced the mobile wallet money opportunity in East Africa, and how hospitals such as the Virtual Mercy in America has designed a hospital that doesn't have any patients and just facilitates healthcare digitally with no beds, just doctors and nurses. It looks like a flight control tower. Thank you. Next slide. Next slide. Thank you. So we really research our markets when we go into them, because we really want to understand the perceptions and attitudes and values. And when we went into Kenya, we did ask them, you know, how do they feel about sort of services and approach to healthcare? 93% wanted a preventative and well-being relationship. 87% wanted to use technology such as wearables. Imagine linking all that data then back into the health insurer environment. 85% wanted support on their medical journey, and 81% wanted to have the ability to message a doctor on the phone. Thank you. So my final thoughts. With such seismic shift in having to embrace digital services across all aspects of our life, whether it's a Friday night Zoom pub quiz night, who's done that? Working, schooling our children, can telehealth be the new normal now and an accepted way to use healthcare services? Overnight, we have been forced to live our lives digitally, and even grandparents are picking up tablets and using the video section of their phone when previously it's just been a text and a phone call. The coronial kid will think nothing of accessing doctors or healthcare advice online, even before this pandemic. And even before this pandemic, my 15-year-old daughter, she's a Gen Z, would turn her nose up at sitting in a doctor's surgery. So regardless of being in a developed or emerging healthcare market, we are living in such a connected world that I think healthcare transformation, particularly accessing primary care, has been given an immense opportunity to really reinvent its consumer proposition and become an integral part of our life. Thank you.
Wonderful. Thank you so much, Michelle. That was brilliant. And, you know, how insightful. And I think possibly the soundbite of the webinar, the coronial kids, that's absolutely a keeper. We're going to be talking about the coronial kids from now on. And you can see there that Michelle's contact details are on our last slide. All of the slide decks will be sent to all of you who are attending, and you will have all of the speakers' contact details. You can email them directly. I'm really happy to see some great conversations in the questions window. Some of them are being answered directly by our speakers, so feel free to get involved, ask some questions in there, and we might even read a few of those out later on in the webinar. But that was great. So coronial kids, that idea of moving from a payer to a partner, and the quote unquote overnight success of telehealth. And now it is business as usual for some enormous societal reasons. You mentioned that shortage of 13 million healthcare workers. Absolutely incredible. So I just would like to discuss what we've just run through with our expert speakers now. Starting with your good self, Kim, I wonder, could you all put yourselves on video if it's convenient there, and we can just have a bit of a chat, because you can all kind of jump in and hop on the answers of the other speakers. But I'd like to start with you, Kim. And I think, beans, UFOs, absolutely. I love that way of framing it. It's like, what are we actually going to use after the pandemic? And one of the main things that I'm hearing loud and clear is that our evolution to a species of Phono sapiens is almost complete. We need to do everything on our phones, and that's just absolutely clear. And you mentioned that services need to go where people are. And of course, people are on their mobile devices now. Why do you think it's taken so long? And do you think that the COVID-19 pandemic is really accelerating what should have happened a while ago?
So I think that what's happening with okay, so there are two parts to that question. So I'll start with the first one. So why is it taking so long? I think the reason is that a lot of healthcare services are designed from the perspective of providers or payers, but not from patients. And so there's this tendency to say, well, if the doctor knows this extra bit here, or if we want to be really sure, we have to make sure we ask that as well. And then the result is, it takes someone filling out a questionnaire of 30 questions to be able to be told, you might have one of these 10 symptoms or these 10 diseases, because again, everybody's hedging their bet, everybody's trying to be safe. And so again, if you're designing services from the perspective of a provider, then you really can't expect high engagement with users. So I think what's happened is that's what was wrong in the first place, I would say, with a lot of digital health services. And what's happened, I think, is that now we've had this giant kick in the pants of the users and pushed people into the arms of these services that were waiting. I think that many of them will be impressed with what they find. Many of them will stay, but I actually think the majority of people are still going to opt for convenience, particularly for an initial consultation. And then when it becomes necessary, then they'll have had that experience with more in-depth services, and they'll say, okay, what's next? Right. I had a really great experience doing a video consultation. Let me go try that. Right. So I think that the key here is that at every stage of the user journey, of the patient journey, there's the right way to reach people. There's a question of where they are and how to meet them. And I think what's happened is people have just shifted. People are in a different place right now than they were, a couple months ago. And I would imagine that over time, we're going to go back to some form of where we were before, although things will have changed, right? Again, this is the question: to what degree will we be eating more beans? It's a question. I don't have an answer to it necessarily yet.
Watch this space. Absolutely. I'll be watching beans with great interest. So yeah, buy telehealth, sell beans. Fantastic. Dominic, you spoke about some of the real advantages for Allianz partners around engaging with telehealth as a technology. So things like engagement and cost containment as well. Talk to us a bit about, are there any other factors such as the scalability come into play? It feels like there's many, many different market kind of dynamics coming into play, and you can observe this from the viewpoint of Allianz partners.
Yeah, absolutely. And I've seen we've been getting a couple of questions as well in terms of return on investments and what other value drivers would be there other than just reducing doctors' visits. So from a commercial perspective, I believe, there's a couple of different aspects that need to be taken into account. So of course, and Kim can elaborate on that later, is how and what the specific figures are. I think you're claiming up to 70% in reduction in necessary doctor visits or unnecessary ER and doctor visits. I think a key point also from the perspective of an insurance company is really the network steering part of it. And there is a lot of let's say a lot of cost containment potential in being able to make sure, and also quality potential, because, of course, because when we have, for example, travelers traveling the world, and there's many different countries where there's lots of, let's say, fraud being involved, and where people are basically also being ripped off by doctors. So as an insurance company, we really want to make sure that they are using the doctors we trust, and of course that are also not overcharging. So being able to digitally steer this will add another layer, because you don't need to take a call, you don't need to make an appointment. You can basically, out of the chat, display what kind, you could recognize where he is right now through geolocation, and you could basically say, okay, you're in Antalya, for example, and the next doctor is 350 meters away. Please go see that one because we trust him. So I think the network steering part is probably one of the biggest cost containment potentials that we have. There's some other factors though to take into account, and we see this, for example, with the mental health issue that we were talking about before. We see that people, will more easily use their phone in terms of because there's a certain level of anonymity considered with it. So they will ask more questions that are potentially also a little bit sensitive. So you wouldn't phone a doctor and would, call him about, let's say, some sexual issues that you might have, for example. And so the willingness to use it is the barrier of entry is very low. And this also gives the potential, because rather than, being unguided by misinformation somewhere on social media, if you get a real profound information from a physician, the answer could also be, even though the symptoms are minor, you might have something that you really would need to get checked out. So you should see a doctor. So there is a prevention aspect to it as well. And we see it specifically on this mental health topic, for example, where just, people going into burnout or developing a depression, they act when it's too late, when they're already broken down. And the same thing is true for other health-related questions. Another aspect, which is probably not as much measurable, but I think should also be taken into account, is if you talk to insurance companies at the moment, I mean, it's been going on for the last years, of course, there is a key aspect in really wanting to control the interface to the customer and wanting to have a direct access to the customer. And by pushing engagement, being, Michelle talked about that, not being one-way transactional, but really having, let's say, a two-way communication going on. And with a service like micro consultation, you could reach out to all of your health insured clients, for example. And this can, of course, be used for some additional information, and there is a cross-selling part of it as well. But you need to be careful in terms of how to assess, how much would you like to use this channel. But also, I mean, you can post valuable information that are health-related to all your health insured, and we need to consider that in most of the markets that we act in, and I'm sure it's similar in the rest of the world, that for a lot of health insurances, there is an intermediary between. So oftentimes, and this is a practical view, the insurance company covering the client doesn't even have contact details. So if you're wanting to pass on a very important information that considers the health, for example, let's take COVID-19 at the moment, and post some valuable information in terms of how clients should react and how you advise them to behave in a certain environment, you could also use that as a channel. And I think these are, let's say, the main aspects also that contribute to positive ROI of such a solution. And of course, I mean, if you compare the cost of, let's say, a video consultation, a teleconsultation, and a micro consultation, there's also a big difference. So this is what makes it quite powerful for us as well, and which spikes so much interest among insurance companies.
Fascinating. I'm really glad you mentioned that two-way aspect of the consultation. I worked for many years in mobile messaging, so it was great to see some questions coming in from MessageBird, who I know very well. But what people sometimes forget about messaging and even about SMS is that it's global and it's two-way. And people in any corner of the world don't need any training to receive and reply to an SMS message. So this is why, one of the reasons why solutions like Abby excite me so much. It's global, it's two-way, and it can bring huge value. And SMS messages typically have an open rate of 98%, which, that's if you need to send important information to your clients, it's one of the best ways you can possibly do it. So moving on to you, Michelle, you spoke about the success of, innovative kind of lightweight, leapfrogging mobile solutions like M-Pesa, and your focus is on the African markets in particular. Talk to us a bit about, developing markets and how this technology plays out. And, is this the phrase Dr. Google sometimes comes to mind? Is that is that something you're trying to avoid, or just make sure people are protected from in some way?
I mean, in certain markets, we're doing a lot of work in Nigeria, as I've mentioned, and a lot of their doctors and nurses are leaving Nigeria and going to the US and going to the UK. So they've got diminishing numbers and they find it really difficult to access. They're so savvy. I mean, some of my clients that I go and see have got 3 smartphones on their desk for each, like MTN or Glow, all the providers. So they're so advanced because they haven't had the legacy telecom systems that we've had and we've been used to. So they have, in fact, sort of jumped over, and that enables them. One of our clients in a previous role, Ericsson, were building infrastructure in Africa, and they're even in places like Chad, developing Chad's sort of mobile infrastructure. So it just enables that customer segment to be able to use digital solutions so much more effectively. And I always have it in my head, the guy on the street has now got access to money that would have never been able to have got a bank account because he couldn't produce the credentials to open an account. And now he can transfer money from his daily, sort of market stall, and he can transfer and pay bills and get insurance. And so for me, in my head, the primary care delivery just emulates that, to be able to access healthcare from their phones. And we did a bit of research with MTN a couple of years ago because we were looking at doing a digital doctor service in MTN in Nigeria. We've got 60 million customers. And I said, but would they be able to afford X, Y, Z? And he went, you would be surprised the amount of money they spend on apps, ringtones, downloads. And so, even the smartphone, it's not an Apple and it's not a Samsung in lower demographics. There's some China and Asian brands, but it's really, really penetrated. A lot of people have got smartphone ability and access. So yeah, that's why I feel really passionate about it, because it's it could be such a mass hygiene proposition for the many.
Yeah. 100%. And that kind of echoes a bit what Kim was saying earlier with the idea of solutions being built for the solution provider rather than the customer. And my favorite / most infuriating example of this is, ringing up a call center and sitting on the queue and hearing the immortal message, "Your call is very important to us. Please enjoy this 40-minute flute solo." So that just drives me crazy. And that's old thinking. That's a solution designed for the convenience of the provider rather than the engagement and the high levels of service that our new phono sapiens all over the world now expect, thanks to our adoption of mobile technology. So Kim, coming back to yourself, there is, telehealth has an important role to play in the times that we live in under the COVID-19 pandemic, in terms of making sure there is less misinformation and making sure people are getting advice from qualified doctors rather than just whatever they're coming across online. Talk to us a bit about the role of micro consultations in ensuring that people get good information.
Step 1, unmute myself. So yeah, no, I think this is, it's been mentioned a number of times by many sources over the last couple of months that there is a sort of secondary information pandemic going on, conspiracy theories, misinformation, dodgy advice floating all over the place. And I think we're living in an era where communication media have made everyone or many people feel that they are a sort of instant expert in many areas, and they're able to voice their opinion about things that maybe they don't have the best knowledge in. But I think we're also seeing in this moment there's a little bit of a backlash against that and towards science, towards evidence base, towards expertise. And it's something that we've always believed very strongly in. And in fact, you can see that the users themselves, when they use a service where they're getting an answer from a real doctor, a doctor who's named to them, a doctor from their home country, who understands their language and their culture, the result is that their behavior changes when they see that answer. We know this from research on our own users, that if our doctors tell our users, you're fine, you don't need to go see a doctor, they don't. And if they tell them you need to go see a doctor, they do. And I think it speaks to the power of expertise, which I think is really more relevant than ever. We also have the ability with text consultations. You have this added ability to really keep a record of every consultation. So you can very easily audit, you can very easily quality control. And of course, users provide feedback. They provide a rating on every micro consultation, which then prioritizes doctors for future consultations. So all of that leads to an environment where the level of trust is very high. And I think it is absolutely an antidote to a lot of the, again, dodgy information floating around at a moment like this.
Absolutely. I'm glad you mentioned trust because we happen to have another webinar coming up in a few weeks' time. That will be on the 27th of May. And that's with some fantastic experts on digital privacy and trust. I will mention the full details of this at the end of the webinar, and you will all get an invitation as a thank you for joining us today. So I noticed, not a million miles away, sort of on the same subject matter, one of our guests today, Sabrina Ibrahimovic, has asked a question about the details of patients. So Kim, staying with yourself, talk to us a bit about the nature of, you mentioned that the doctors are certified, that they're vetted, that they are rated by their patients. What is the visibility or the privacy, should I say, of the patients to the doctors on the Abbey platform?
Yeah, so the users actually remain anonymous toward the doctors. So the doctor sees only age, gender, location, nationality when that's relevant, for example, with travel. Yeah. And we think that that's key to what Dominic was mentioning before, that it makes people feel able to ask more sensitive questions. Of course, the medium itself of text also makes people more comfortable with more sensitive questions. And then in terms of the patient records, of course, those are stored encrypted and secure within the European Union for EU users. I think that there's been a tendency to just immediately discount some of these communication channels as not secure, not compliant, when in fact, if you start to dig into it, you realize that there are ways to use these channels. Again, for example, in the way that we do, where the user and the doctor are not chatting directly, but it's a mediated asynchronous discussion with artificial intelligence in the middle, that there are ways to, again, deliver the kind of convenience that people are looking for without sacrificing compliance, privacy, security.
And I'd love to stay with you for one more moment. Talk to us a bit about the benefits or the characteristics of asynchronous conversations, because I think that's quite an interesting differentiator, and that this is where a lot of the kind of the time machine for healthcare professionals comes back.
Yeah, well, this is again something that Dominic mentioned earlier as well. That so because with a synchronous interaction, if it's a live, like what we're doing right here, right? As I'm speaking, you're waiting, and as you speak, I'm waiting. And so that means, it takes the time that it takes for us to have the discussion. And in some sense, the basic unit of cost in any interaction with a physician is the physician's time. And so whether that's in person or video or phone, that unit of cost is usually in the sort of 10-minute range. And with an asynchronous approach, we're actually able to get that down to as little as 1 minute per consultation. So what you see is on average about an 85% decrease in physician time per case with an asynchronous micro-consultation approach. And that, of course, has significant impact on return on investment. Again, as Dominic mentioned, we're still seeing about a 70% reduction in unnecessary doctor visits. So they still have the impact, but with a lot lower, with a lot more efficient delivery.
Fantastic, thank you. So I wonder if I could just, present an open question to all of you. How do you see telehealth evolving in the future? I mean, could it be, go the way of a telco? How do we think it might be presented to people? We heard the example of it being offered by a gas company, which seems a bit strange. But what do we think the place of telehealth is? When hopefully the pandemic eases down and we kind of approach the new normal after COVID-19 and beyond. So open question.
If I can start on this one, for example, I think that the technology, I wouldn't be surprised if like within the next 5 years, there's even a new technology, maybe for diagnosis, there might be something, but I really see, and what we see in the market as well, is that the integration of the different aspects that are already there, that there will be a coherent system. Basically also what we're trying to build. So give people access through a range of different channels and give them the free choice. The health insurer, for example. And so it might well be that, you have a symptom. So in an ideal world, you have a symptom checker. Okay, then you would like to verify whatever the symptoms could be. Then you go on to the chat. You're chatting with a doctor. The doctor feels you should really speak to a doctor or see a doctor, and then you are basically transferred to the next sort of channel or medium. Also coming back to this question that Kim earlier asked, because I see it in the chat in terms of medical history, I think it's very important for the first entry to be anonymous, and I think that's a key in micro consultation and text-based consultations. But of course, we're discussing also, let's say, more elaborate systems with partners of us that want to use more than one channel because they believe in this coherent system, in the parts playing harmoniously together. And then you need to look at, because it's pretty much the same thing as with us being a call center provider, being passed from one person to another. You want to make sure that, what has been discussed, that the doctor who's picking up the phone, he already knows. So there's, of course, from a technology perspective, absolutely ways that we're looking into with partners as well to transfer, let's say, the medical chat to the doctor, then picking up the phone or even providing it to the doctor that will see the individual. Of course, this needs to be taken with sensitivity, but we'll specifically as Allianz Group take very, very seriously. But I think that's also an important aspect that needs to be considered when it comes to transferring medical histories or records.
Absolutely, and keep an eye on the old jazz flute on the in the call centers. I think that's one of my key metrics with using any service. Michelle, how do you see telehealth evolving, and what does telehealth of the future look like?
Yeah, for me, we're working on looking at lifestyle and creating lifestyle platforms and ecosystem, using a lot of our Collinson internal capability and then using our experience in using partnerships such as Abby. So feeding into an area that you can use, that you can track, that you can talk to a doctor, that you can manage chronic illness, that you can have your ID protected, because that's another part of some of our proposition, that you have a loyalty-based program. So for us, we're looking at it really holistically as an entire ecosystem, and telehealth, that ability to chat to the doctor will be an integral part of the proposition.
Yeah, fantastic. Okay, and same question to you, Kim. I mean, you've got incredible visibility of how asynchronous text-based micro consultations are being used, how they're being rolled out through your strategic partnerships. Where do you think this could all go?
Well, so first of all, I agree absolutely with Michelle, and I think Dominic shares the same vision that it's a small part of a larger journey. But I think that my opinion is it's exactly the thing that's been missing. There are an array of amazing services that are being developed, that are already available, and what's been missing is this bridge between where people are and all these great services. And so my view is that there's going to be widespread adoption over the next 2 years. We plan to be in 100 markets, and I think that our goal is to drive that adoption of the larger telemedicine or larger telehealth spectrum of services by being a bridge from where people are into all these other services, and that's really how we see our role and how we see the evolution of this space.
Okay, fantastic. Thank you. So I'm afraid that's all we have time for. Before we go, I just do hold on the line because we do want to share everyone's contact details with you. And also we'd like to share the results of the polls. So we'll just share the results of the polls right now. And we can see there that COVID-19 is by far driving the rise of telehealth, with customer engagement a close second at 21 answers there. So thank you everyone who took part in poll number 1. Poll number 2 asked, what kinds of telehealth does your company offer? And very interesting to see that chat-based is hugely popular. So it may not be just that telehealth is an idea whose time has come, but also chat-based telehealth is an idea whose time has come. So I just wanted to say sincere thank you to all of our brilliant speakers today for sharing your great insights and your view of the future. It was really, really genuinely fascinating. So thank you so much. Kim Fredrik Schneider, the CEO and co-founder of Abbey Global Health. Dominic Gantner, thank you. Dominic Gantner, the CSO, Austria and Southeast Europe region at Allianz Partners. And Michelle Elmore, thank you, Head of International Healthcare Business Development at Collinson Group. So I'm just going to put everyone's contact details there on the screen. So if you want to get in touch with them, please feel free to reach out, contact them directly, and a copy of this presentation will be emailed to all of you together with everyone's presentations. So you'll have all the presentations, all of the contact details, and we are looking forward to hearing from you. I am on LinkedIn as well. Please reach out to me on LinkedIn. I'd like to make new connections. So all of you will get the presentations and a full replay of the webinar emailed to you tomorrow. Thank you so much for joining us. As I mentioned earlier, please join us for a follow-up webinar on the 27th of May, and that is called Why Trust is the New Oil and Why Telehealth is the New Trust. And I'm thrilled to announce that we have some brilliant speakers for our next webinar. The first is going to be Emerald Delieu, who is a GDPR rockstar, a bona fide GDPR rockstar and TEDx speaker. Then we're going to have privacy pioneer and one of the leading minds in the space, Philippa Jane Farley from Pro Privacy. And we were very grateful to be joined again by Kim Fredrik Schneider, the co-founder and CEO of Abbey Global Health. So you will all get an email to that second webinar. Please feel free to share with your friends and family. So thank you all so much for your time. I hope you enjoyed the webinar. Please do continue the conversation on social media and drop us all an email with any further questions. Thank you.
Thanks.
Thanks, Eugene.
Bye.
Thank you, everyone. Thanks, Michelle. Thanks, Dominic.
Bye.